There are certain procedures that are very uncomfortable for both the healthcare practitioner and the patient, and one of them is a digital rectal examination. So this involves me as a medical practitioner doing this on a fellow man. So you have to bend over a man and then put your finger inside his bottom and then feel for an organ. Very uncomfortable. But we have to do this because we are feeling for an organ known as the prostate. The prostate is important because it can become cancerous in certain people. Its normal size is about the size of a golf ball, and it's found right beneath your bladder as shown in this diagram. An important thing about the prostate is that you have to pay attention to where it is placed anatomically. Its functions involve, number one, adding bulk to the semen that the man ejaculates. So normally, your ejaculate doesn't only contain sperm, it contains other fluids as well. Number two is that the prostate produces PSA. PSA is prostate-specific antigen, and this just helps in making these sperms a little bit more mobile so that they can easily move around. Number three, the prostate assists in ejaculation. So that strength that comes out, the prostate has muscles too that helps it push it further. Another function of the prostate is that it converts testosterone, which is usually the male hormone, and then converts it to dihydrotestosterone. We'll refer to it as DHT going forward. Now, DHT is a very, very important part of this conversation because this one is the one that gives you as a man the features that you have. So that beard, that hoarse voice and different things is the one that ends up doing that job. Now, when it comes at a wrong time is when it leads to things like prostate cancer. So now we know what the normal prostate is. So what is prostate cancer? Like any other cancer, it's just the abnormal growth of the cells in the prostate where they become so uncontrolled. And who's usually at risk of developing this cancer? Many people, but largely in three groups. Number one, if you're a man above the age of 50, especially above the age of 65. Number two, if you have a family history of the prostate cancer. And thirdly, black race. We'll then go back to this normal organ, the prostate. Now I want us to look at this photo and then see how it's related to the surrounding structures. Number one, you can notice that it's surrounding two tubes. Number one, which is your urethra. The urethra carries urine from the bladder here and then takes it to the outside. Number two is that there's a seminal duct. Now this seminal duct is carrying sperm from the testicles and then getting it out through the manhood in certain situations. How the prostate is in very close connection with these two tubes is what's going to bring about the symptoms that we get to see in prostate cancer. Number one, let's take for instance, this organ has started growing so much that it is compressing on these two tubes. Number one, if it's compressing on the urethra, the one that's dealing with our urine, the symptoms that you'll get to see will be as a result of that same blockage. Number one, you'll have urine in your bladder, but it's not coming out as effectively, meaning you'll feel the urge to go and urinate, but you're not urinating. When you go to the bathroom, you try to urinate, and then it takes so much time just for it to come out. The reason being that you're trying to overcome this same obstruction by using more energy. Number two is that you might urinate, but with a very weak stream, meaning the urine is supposed to be normally, let's say it jumps like a 1 meter, but now it's only going like, let's say, half that distance. This is a very key sign. Number three is that you can be feeling pain. Certain people can start to see blood in this same urine. In certain times, you'll have urine that's coming out in bits, which we call dribbling. Some urine comes out and then stops. Urine comes out and then stops. All these collectively are known as urinary tract symptoms, and majorly are a key sign of prostate cancer. How about the compression of this other duct that we talked about, this little tube? Number one is that you may see blood when you ejaculate as a man. You see blood in your semen. Number two, collectively, together with these lower urinary tract symptoms, you'll start to see things like erectile dysfunction, painful ejaculation, because remember, this tube is blocked and you're trying to unblock it during this same period. Now, I want you to get one important point. These symptoms usually come about when this prostate has become so big. The key thing is that majority of the time you'll have zero symptoms. And this is very dangerous because the time that you're getting to catch it, it means that it's already moved. And in terms of moving, medically we call this metastasizing, meaning it's moving from its original point to other parts in the body. It's going to move mainly to your bones, and in the bones, it's going to move to your spine. Now, in the spine, majority of what people complain of is a chronic back pain. So a back pain that has been there for some time. It doesn't go away. With rest, with painkillers, it's just there. Number two, if it has invaded your spinal cord is there too. You start feeling weak in your feet, both of them. If it spreads to other bones, you might start easily getting fractures that you don't understand. Just a simple amount of force will give you a fracture, and this is a very, very bad sign. And you should know that primarily your bones are the ones that are creating these red blood cells that you have. So one thing that you'll see in such patients is a very, very good history of anemia. Now, this thing shouldn't be as sad as it seems, because you're catching these symptoms when they have already messed you up. So what's the important thing here is that you need to be screening before the problem actually worsens. And methods of screening are many, but mainly we use two. And this is one, through that poking of the finger, and number two is through a PSA. So remember, the PSA we did talk about is this thing that's being produced by the prostate to help the sperm be able to move. We call it liquefaction, to just be able to maneuver around quickly. Now, this PSA is produced in very huge amounts when you have a prostate cancer. And the simple logic is this: cancer cells are like very unruly. They just do things based on what they want. They look like your cells, but they are more energetic. So where your normal cell was producing, let's say, about 10, it will be producing 1,000. So this is particularly what we test for. When we find that the PSA is very high, it gives us a suspicion to say that this may be a cancer. But of course, the PSA has got a lot of things that can raise it. Things like prostatitis, which is an inflammation or an infection in your prostate. Riding a bike very vigorously can actually raise your PSA. So it can be unreliable in certain cases. And this is where this finger comes in. When we insert the finger, as shown in this photo, what we feel for is that same part of the prostate behind where cancers usually start from. What we'll feel for is the normal consistency, how it normally feels. And then if we find bumps and we find things that are rough, which is how normally cancers are, they act normal, but they're not normal. So you feel like some roughness there, you feel some different texture. This gives you an idea to say this could be a prostate cancer. These days things are a little bit better. Back then we could rush straight to poking the finger even without the PSA, but now the PSA is a guide to help us to see if this is already something that is of concern. So when it's above a certain range, we can then subject you to the finger. So the important thing in this conversation that we're having is that prostate cancer is very quiet, and when you start seeing symptoms, it's probably too late. So the important thing is you need to screen, and screening is done through PSA, through digital rectal exam, and this is done each and every year. So this gives us a very good amount of time. Imagine catching this thing early. Something can be done very quickly, and then you'll be okay. If you find that the PSA is very high and your prostate is looking funny but you don't have symptoms, in our setting in Zambia, you'll be subjected to do a prostate biopsy. This involves you being taken to theater, and then a gun, sort of like as shown in this photo, is going to be put through your anal region to go and get a piece of that prostate and then take it to the lab. The lab will then tell us if this is cancerous or not, and then further steps are going to be done according to what we find. The important thing, again, in this conversation is that if you're a man above the age of 40, start screening for prostate cancer.